If you're a healthcare professional with an established cosmetic or aesthetic practice, and you want to find out more about the treatment of facial spider veins, this video tutorial is for you. We're diving deep into the actual technique of treating facial spider veins using shortwave diathermy. By the end of this How to Treat Facial Spider Veins tutorial, you will have a complete step-by-step protocol that can be implemented in your practice. You'll know exactly what equipment to use, how to prepare your patients, and most importantly, how to perform the treatment safely and effectively. This is the tutorial where theory meets practice. Now, before we start, just to be clear, this video tutorial is not a substitute for proper, professional, hands-on training. And be mindful that only suitably trained and competent professionals with indemnity should treat facial spider veins. That said, let's dive in. And here's what we're covering in this video tutorial. First, we'll talk about patient selection. Not every patient with facial spider veins is suitable for this treatment, and knowing who to accept and who to decline is crucial for your success and reputation. Second, we'll walk through the equipment setup and preparation, both for your treatment room and for your patient. We'll cover the 7-day preparation protocol, which is something that sets you apart from your competitors and dramatically improves your results. Third, and this is the core of the video tutorial today, we'll go through the complete step-by-step treatment protocol. I'll share the exact sequence I use, the power settings, the technique, everything. And finally, we'll cover the common pitfalls I see practitioners make and how to avoid them. These are lessons I learned the hard way over 15 years and after treating over 100 patients. And I'll share them with you so you don't have to make the same mistakes. And be sure to stay to the end when I will tell you the business case for offering facial spider vein treatment and adding it to your aesthetic clinic, and I'll give you 5 tips for building your confidence. Let's start with patient selection because, to be frank, this is where success begins. Before you ever turn on the machine, your ideal patient is someone who is fit and healthy with no significant past medical history, no significant dermatological history. We're not looking for complex medical cases here. The simpler the patient profile, the better your outcome. They should have isolated spider veins, meaning small clusters on the cheeks, chin, or nose, not diffuse redness across the entire face. Those isolated clusters are your sweet spot, especially when you're building confidence. The vessel should be small, less than 1 millimeter in diameter. These are very superficial telangiectasias that respond beautifully to shortwave diathermy. If you're looking at larger bulging veins or deeper blue veins on your patient's face, those are not suitable for this technique. And crucially, your patients need realistic expectations. So be sure during your consultation to make sure they understand that this is a gradual process, that some redness and scabbing is normal, and that a second treatment may be needed. Managing expectations up front before you start treating patients prevents disappointment and disappointed and unhappy patients later. During the consultation, give your patient a mirror and get your patient to show you exactly which veins bother them. Now, within that ideal patient profile, what specific veins should you be looking for? Well, you want to treat bright red telangiectasias on the cheeks. These are your best candidates. These are often arterial despite being called veins, and they respond incredibly well. They're superficial, easy to visualize, and patients are highly motivated because these veins are so visible. Spider veins around the nasal alar and around the nostrils are also excellent candidates for treatment. Patients are often embarrassed by these. They can't cover them up easily with makeup, and they're highly visible in social situations. Patients with these sorts of veins become some of your happiest success stories. Spider veins on the chin also respond well. Look for isolated clusters rather than diffuse redness. If the patient has generalized facial flushing or what looks like rosacea with widespread redness, that's not telangiectasia. That's a different condition that needs to be addressed first. Remember, you're looking for individual vessels or small groups that you can target precisely. That's where shortwave diathermy really excels. Now let's talk about who you cannot treat. These are the contraindications that keep you on track and out of difficulty. Active facial infections like impetigo or herpes simplex. If they have a cold sore outbreak or any active infection, reschedule immediately. Don't treat. You cannot treat through active infection. You'll only spread the infection and make things worse. Active rosacea is a relative contraindication, and this is important. If someone has active rosacea with inflammation, the rosacea should be treated first for 4 to 6 weeks with topical treatments. Get them into remission, then you can treat the residual telangiectasias. If you have expertise in managing rosacea, fine, go ahead and treat the rosacea. If not, refer to a dermatologist or a colleague with specialist expertise. Pacemakers or implantable cardiac defibrillators are another absolute contraindication. The electrical current may interfere with these devices. Not always, but you can't be sure. So always ask about cardiac devices in your medical history. Also ask about keloid scar formation. These patients have abnormal wound healing and are at high risk of scarring complications. Treating with shortwave diathermy is just not worth the risk. Document all of these things in your consultation notes. If someone has any of these contraindications, explain why you cannot proceed. Your patients may be disappointed, but they'll thank you for your professionalism. Let's talk about the equipment. The good news is that the barrier to entry for shortwave diathermy is remarkably low compared to lasers or IPL, intense pulse light. I recommend you get the Epil 100 diathermy machine. This machine delivers 4.2 megahertz at 300 volts with an almost perfect sine wave. Now look at the other pieces of equipment that cost a lot more. Compare that to £20,000 to £40,000 for a laser. And there's no need to make your room laser-proof or deal with non-ionizing radiation regulations. In addition to the Epil 100 shortwave diathermy, you need Sterex insulated needles, specifically the F3I regular. The insulation in this needle is critical. It protects the skin surface while the exposed tip targets the vessel. These are single-use sterile needles. You'll go through perhaps 1 or 2 per patient. I also recommend the use of LMX4 local anesthetic cream. Apply this 30 minutes before treatment. Some practitioners claim this procedure is painless and skip the anesthetic. That has not been my experience. Your patients will appreciate the anesthetic, especially around the nose where it can be quite sensitive. And finally, I suggest you get aloe vera gel. Keep it in the fridge, keep it cold, and have ice packs available. The patient can purchase aloe vera gel before their appointment, and they can keep their supplies in their fridge at home. I think cooling is essential for preventing complications and improving comfort. In total, the consumables cost less than £10 per patient session. The pre-treatment protocol. Now here's something that sets professional practitioners apart. The pre-treatment protocol. This isn't just about the day of treatment. It starts 7 days before your patient has the treatment. Your patient needs to moisturize their skin for 7 days before treatment. Any good quality moisturizer works. Boots number 7 is what I recommend if they don't have a moisturizing routine already. In my opinion, this skin preparation is critical. It ensures good conduction of the current from the needle to the vessel, which means that you can use lower power settings, and this reduces the risk of thermal injury. I also think that clinical photography at every stage of the consultation, treatment day, and follow-up is vital. This isn't optional because photos protect you medico-legally. They help you track results, and they're invaluable for your marketing later when you have before and after photo galleries. Apply local anesthetic cream 30 minutes before the procedure. You can build this into your workflow. Have your patients arrive 30 minutes before their actual appointment for treatment. Get your assistant or your receptionist to apply the cream and let your patients relax in the waiting area. And critically, separate the consultation from the treatment day. Don't consult and treat on the same day. This demonstrates your commitment to valid, informed consent. It also gives the patient time to think about what you've explained during the consent process, to prepare their skin, and to purchase their aloe vera gel. This is best professional practice. Now, I know some of you might think separating consultation and treatment is leaving money on the table. Well, actually, I think it's the opposite. It demonstrates professionalism, improves outcomes, and protects you medico-legally. And patients who go away and come back are more committed and less likely to have difficulties and cause you problems professionally. Let's talk about setting up your treatment room for success. Your patient should be supine with the back of the couch slightly raised. About 30 degrees is comfortable. This position gives you good access to the face and is comfortable for the patient during what might be a 20 to 30 minute procedure at its longest. Most procedures are 10 to 15 minute sessions. Good magnification and lighting are essential. Can't overstate this. You're working with vessels that are less than 1 millimeter in diameter. You need to see clearly what you're doing. Use magnification loupes or a magnifying lamp and ensure you have good overhead lighting that doesn't create shadows. Use a mobile trolley with a sharp spin within reach. You'll be disposing of needles immediately after use. Try not to reach across the patient or turn away from them. The sharp spin should be right there, ideally attached to your mobile trolley, so it moves with you. And have your ice packs and cold aloe vera gel ready to go. Take the aloe vera gel out of the fridge at the start of the procedure, so it's ready when you need it. Ice packs should be prepared in advance and ready to use. This setup might seem basic, but I've seen practitioners struggle because they didn't think through their ergonomics. You might be standing for 30 minutes, so make sure you're comfortable or you'll develop back and neck strain. Now let's get to the heart of today's video tutorial, the actual procedure. I'm going to walk you through this step by step, exactly as I do it. First, load your insulated needle into the needle holder using an aseptic technique. Hold the needle at 90 degrees angle to the skin. This is important. Not 45 degrees, not shallow, perpendicular to the skin. With the Epil 100 Shortwave Diathermy machine, start at 20 units intensity power. This is your baseline. You'll titrate up from here, but always start low. Pierce the epidermis with just enough pressure so that the needle is adjacent to the vessel. You're not trying to pierce the vessel. You're positioning the needle tip right next to it. The heat will do the work of closing the vessel. Apply the current for 1 second using the hand switch on the needle holder. 1 second, no more. Press, count 1000, release. Now, as you do that, watch for blanching. If the vessel turns white and disappears, you've found your power setting. If nothing happens, you need to increase the power setting or the intensity setting. This is where beginners often struggle. They either use too much power too quickly, or they're too timid and they never find the effective power setting. Be systematic. Start at 20 and increase methodically as judged by the reaction of the vessel to the treatment. Look for blanching, that white appearance of the vessel as the blood coagulates. That's the end point. That's what tells you the treatment has worked. If no blanching occurs, withdraw the needle and increase your power setting by 1 to 2 units, and then repeat. Try again on the same vessel, perhaps a slightly different spot. Keep increasing the power setting slowly and gradually until you see blanching. The typical range is 20 to 27 units for most patients and most vessels. You'll rarely need to go above 27. If you're at 30 units and seeing no effect, something is wrong. Maybe your needle isn't making good contact, or maybe the vessel isn't suitable. Once you've found your effective power setting, let's say it's 24 units, you then treat along the entire length of the vessel at 1 to 2 millimeter increments. You're essentially creating a series of diathermy injury points along the vessel, and the entire vessel will thrombose and be absorbed as part of the healing process. Think of it like a row of dominoes. You treat every 1 to 2 millimeters along the vessel's course. Now let's look at the treatment being done. In the following examples, the patients were fit and healthy with no systemic illness such as liver disease or alcohol abuse, and they were on no medication. They had so-called idiopathic telangiectasias. In this case, the equipment setting is 25.9. That has been gradually titrated to the patient's skin, and it's the lowest setting at which the vessel blanching is achieved. This gives you an idea of how fine the needle is for applying the current to the vessel. As mentioned earlier, local anesthetic cream ensures that the patient is comfortable during the procedure, and you are more comfortable knowing that you're not hurting the patient. You can see the rhythm of the procedure, and once you get into a rhythm, it becomes smooth and efficient. The sequence is: apply the needle, press the needle switch for 1 second, release and withdraw. Advance at 1 to 2 millimeter intervals and repeat. You see the vessel blanch and it disappears. Apply, press, release, withdraw, advance, repeat. Success is demonstrated by vessel blanching. You're working along the vessel methodically, creating that line of coagulation points. After you've treated an area, maybe you've treated 3 or 4 small vessels in one zone, apply an ice pack for 1 to 2 minutes. The cooling serves 2 purposes. It reduces discomfort for the patient and it protects the skin surface from thermal injury. As you can see, as you apply the current, the vessel blanches and the vessel seems to disappear. Put ice on for 1 to 2 minutes and then repeat after an interval of 1 to 2 minutes. Move on to the next area. At the very end of the entire treatment session, you'll apply cold aloe vera gel liberally across all treated areas. In terms of safety, here's my advice. Use insulated needles. I can't stress this enough. The insulation protects the skin surface. Only the needle tip is exposed and only the tip generates heat adjacent to the vessel. This dramatically reduces the risk of skin surface burns. Apply cooling immediately after treatment. We've talked about ice packs and aloe vera gel. This isn't optional in my opinion. Cooling is part of the safety protocol. Never treat the same vessel twice in one session. This is critical. If you treat a vessel and it blanches, you're done. Don't go back to that vessel again. Don't touch it up thinking you'll get a better result. All you'll do is increase the risk of scarring and pigmentation. And here you can see the great results. The removal of the spider veins, particularly on this patient's nose and cheeks. Great results. very happy patients. And just to repeat my advice, use insulated needles, apply cooling immediately after treatment, never treat the same vessel twice. It's better to undertreat than to risk the possibility of complications. Let me share the most common mistakes I see, because I've made some of them myself early on. Pricking too deeply and causing bleeding. If you see blood, you've transected the vessel. You've gone right through it. The solution is to use less pressure. You want the needle tip through the epidermis and adjacent to the vessel, not through it. Skin sticking to the needle as you withdraw it. If you see this, it means you've used too much current or applied it for too long. The needle has essentially cauterized the skin surface, and that's why it's sticking. Turn down your power setting. Up the rhythm so that you're spending less time on the vessel. Treating the same vessel multiple times. I've mentioned this already, but it's worth repeating. Be systematic. I sometimes use a marker pen to mark vessels I've already treated so I don't accidentally hit them again. Another way to avoid this is to have a routine in which you treat certain areas in a certain order. Using excessive current at the first session, this is another thing I've seen, and beginners often think they need to be aggressive to get results. Actually, conservative treatment gives better results with fewer complications. You can always bring them back for a second session. You can't undo a pit or a scar. Avoid these pitfalls and you'll get excellent outcomes. Now here's something that's also very important. You need to give special consideration for darker skin types, which is incredibly important if you're practicing in diverse communities. Patients with Fitzpatrick skin type 3 or darker have a higher risk of post-inflammatory hyperpigmentation. That means after any injury to the skin, they're more likely to develop dark spots that persist for months. So be warned. For these patients, you need to emphasize the 7-day moisturizing protocol. Well-moisturized skin conducts current better, meaning you can use lower power settings. Using lower power settings, lower currents, and shorter exposure times means that you would probably start at 18 units instead of 20, and maybe you'd apply current for just half a second instead of a full second. Be conservative, be cautious, and make absolutely sure you're using insulated needles and applying cooling immediately after treatment. In your consent process, make sure patients with darker skin understand the risk of temporary hyperpigmentation changes. Most of the time it resolves, but they need to know it's a possibility. Informed consent, realistic expectations, both protect you and they protect your patients. After you've finished treating, here's what happens. Ice pack protocol. Ice for 1 to 2 minutes, off for 1 to 2 minutes, then on again. This immediate cooling is essential. Apply cold aloe vera gel liberally across all treated areas. The patient will take this home and continue applying it for the next few days. It's soothing and it helps with healing. Take clinical photographs immediately after treatment and give your patient a mirror to look at the area immediately after treatment. Although the area may be a little red, most patients are really pleased immediately afterwards because they can see that there's been a big improvement already. The treated areas will look red, possibly there'll be blanching. It's important to take photographs for your records and for showing the patient their progress later. And provide written aftercare instructions. Don't just tell them verbally, give them a printed sheet or email them the instructions. When they get home and can't remember what you've said, they'll have the sheet or the email to refer to. And here's what you should tell every patient after treatment. And it should be on your printed aftercare sheet or in your email. No touching the treated area for 4 to 6 hours and no makeup for 24 hours. They need to leave the area alone to heal. Avoid soap and water for 48 hours. Instead, use a gentle cleanser like Cetaphil. Soap can be too harsh on the treated skin. If they get scabs, don't pick at them. This is very important. Scabs may form and they may look like bramble scratches. It's very tempting for your patients to pick, but picking leads to scarring and pigmentation. Ask your patients to leave them alone and they'll fall off naturally in 7 days. Avoid exercise, saunas and swimming for 48 hours. Anything that raises the body temperature or exposes the area to bacteria or chlorine needs to be avoided. Consider using an SPF 30+ sunscreen. In sunshine, this is mandatory, and they should continue moisturizing their skin for 6 weeks. These instructions might seem excessive, but they prevent and mitigate against complications. Ask your patients to follow them rigidly. It's part of their contribution to success. Set expectations clearly about what happens after treatment. Immediately and for the first 24 hours, they may have redness and possibly swelling. This is normal. Ice and aloe vera gel help. Days 1 to 7, small scabs may form, but they will fall off naturally. The treated areas might look worse before they look better. Prepare them for this. Weeks 2 to 4, the treated veins may temporarily look more noticeable than before treatment. This can cause patients some concern, and they may be very upset if you haven't warned them about this. But it's normal. It's part of the healing process as the coagulated blood is being reabsorbed. Reassure them this is temporary. Week 6, this is when you assess the final results. This is when you schedule your follow-up appointment. At 6 weeks, you can actually judge whether a second treatment is needed. If you don't set these expectations, you'll get panicked phone calls saying, "It looks worse." Prepare them in advance and you won't get those calls. Let's talk about complications because they can happen even with great preparation and perfect technique. Blisters and scabs are the most common. They're usually minor, self-limiting, and resolve without intervention. As long as the patient doesn't pick them, they heal fine. Pigment changes. Hyperpigmentation or hypopigmentation are rare if you've prepared the skin properly, you've got proper technique, but they can occur, especially in darker skin. Most resolve over 3 to 6 months. Scarring is very rare, much less than 1%. And if you're using an insulated needle, the appropriate current levels, you've prepared the skin and you've cooled it afterwards. But it can happen, which is why informed consent is so important. Prevention is everything. Use the minimum effective current. Make sure you cool the skin and make sure you're meticulous in your technique. That's how you avoid complications. And when complications do occur, document them, manage them professionally, and learn from them. Even the best practitioners have occasional complications. How you handle them, how you interact with your patient, that is what determines your professionalism and your reputation. So what determines success with this treatment? Most veins disappear after one treatment with shortwave diathermy. That's the good news. When you do this correctly, you'll see dramatic improvement after just one session. Yes, some patients do require a second session at 6 weeks plus. This is normal and expected. Never promise single session clearance. A systematic approach prevents double treating. Use a methodical pattern. I often work from superior to inferior or from one side of the face to the other, sometimes marking off the area with a skin pen as I complete them. And documentation is critical for assessing the results at follow-up. Write down your power settings, which areas you treated, how the patient tolerated. When they come back at 6 weeks, you'll know exactly what you did, and you can adjust the settings on your shortwave diathermy machine as needed. Success isn't just about technique, it's about having a systematic approach. And a quick word again about rosacea, because you'll encounter this. If a patient has active rosacea with inflammation, the rosacea needs to be treated first for 4 to 6 weeks with topical treatments such as metronidazole or azelaic acid. You should wait for remission before you treat the telangiectasias. If you treat rosacea during its active inflammatory stage, you'll greatly increase the risk of complications. Use topical treatments in patients with rosacea to calm the inflammation, and this reduces the risk of post-treatment flare-up. Don't rush. A patient with active rosacea who comes back in 6 weeks with calm skin is a much better candidate than trying to treat them today. Well, I've been talking about documentation regularly throughout this video tutorial, and I'm going to say it again. It's very important for every treatment. Record the power setting, the final unit number of your machine that was effective. Record the needle batch number and expiry date. This is important from a medico-legal perspective. Measure the treatment duration and the specific areas treated, and document any patient reactions or any adverse events during or immediately after the treatment. This documentation protects you, it helps with follow-up, and it helps you to modify your practice in the light of what you've done. Don't skip it. Don't skip detailed documentation. Now, at the beginning, I said I would give you the business case for adding facial spider vein treatment to your aesthetic clinic. So let's talk numbers. This is about building a profitable cosmetic vein practice. Equipment cost is under £950, and it's a one-time investment. Compare that to multiple figure laser purchases, tens or if not hundreds of thousands of pounds, and consumables for shortwave diathermy are less than £10 per session. Your needles, your anesthetic cream, some aloe vera gel, minimal ongoing consumable costs. And average fees for treating facial spider veins is about £250 per treatment sessions. Some clinics charge considerably more. Even at £250 per treatment session, your profit margin per patient is excellent, and there's no laser-proof room requirements. You can set this up in any treatment room. No special electrical requirements, no regulatory hurdles, no room modification. This is a high-margin service with low cost barrier to entry. If you're already seeing aesthetic patients, this is an obvious addition to your service menu. Now, if you've had appropriate training and mentoring and you're starting out with shortwave diathermy, let me wrap up and give you 5 tips for building your confidence. Start with small, isolated clusters on cheeks. Don't take on complex cases with lots of spider veins all over the face. Build your skills with straightforward patients who have clear, easy to treat vessels. Master the technique before treating veins around the nose, which can be uncomfortable. Nose veins are more sensitive. Patients tolerate the treatment less well, and they're in a very visible location if you get a scab or a blister. Get comfortable with cheek and chin veins first. Build your skill progressively over multiple patients. You might want to see a series of patients and get them to your clinic in quick succession so that you have a batch of patients with facial spider veins that you can build your skills up over a short period of time. There's no substitute for doing the procedure several times over a short period to build your skill. Your first patient might take you 45 minutes. Your 10th patient may take 20 minutes. You'll get quicker and more confident as time goes by. And remember, undertreat initially to avoid complications. Conservative treatment might mean a second session, but that's far better than causing a complication that damages your reputation. And finally, tip 5, use local anesthetic. You will do a better job if you're comfortable knowing that the treatment is not hurting your patient. Finally, be patient with yourself. This is a skill that develops with practice. It's not difficult. You'll get better very quickly. Now, as you can see in these before and after photographs, the results of shortwave diathermy are excellent. The before photo is on the left, and the after photograph is on the right. And these spider veins on the nose and the cheeks were cleared almost completely, and the patient was very happy when she came back for photographs at 6 weeks. And this is an example of a patient with spider veins on the nose who was treated by the healthcare assistant in my clinic. We had the ability to train healthcare assistants with shortwave diathermy, and under supervision, this patient was treated and came back with complete clearance, almost complete clearance of the spider veins on the nose. This gentleman was very happy. So let me summarize the key takeaways from today. Patient selection is critical for success. The right patient makes everything easier. The wrong patient creates problems no matter how good your technique is. The 7-day skin preparation improves outcomes. This isn't an optional procedure, it's non-negotiable. Well-prepared skin means lower power settings, and lower power settings means fewer complications. Have a systematic technique that prevents complications. Follow the protocol. Don't rush, be methodical. A conservative approach yields better results. Undertreat rather than overtreat. You can always bring them back later. These principles will serve you well as you start out implementing this in your practice. Well, I hope you found this video tutorial helpful. If you did, please give it a like and share it. That way, you'll help my channel and you'll get the word out about the treatment of facial spider veins by shortwave diathermy. Be sure to check out all the links in the description box below. Please consider subscribing to my channel. That way, you won't miss my next video. My name's Dr. Haroun Gajraj. Thank you for watching.